Can you tell us more about your area of research and what really attracted you to explore this field in particular?
So my research is mostly focused on liver-directed gene therapy. So the goal is to find a vector that can safely and effectively transfer therapeutic genes to the hepatocytes. So the main goal is to treat the inborn errors of metabolism. And I'm a physician scientist, so I take care of patients with metabolic diseases. So my first goal is to try to bring to these patients something that can really work and can change their lives and improve their quality of life, obviously. So actually I've been very lucky because I have had mentors, outstanding mentors that taught me how to do research, how to address clinically relevant questions. See, this all started when I did my pediatrics residency in Italy, and I had excellent mentors that taught me how to deal with the inborn errors of metabolism on the clinical side. And then I decided to go to study more of these disorders, and I went to Baylor to Baylor College of Medicine in Houston. This was in 2002, and there I found 3 outstanding people that helped me a lot with dealing with this type of problems. So there were Dr. Art Baudet, Brendan Lee, and Philip Bang. So they were quite diverse people that each of them taught me different aspects that were crucial for developing a research on this inborn errors of metabolism.
What does being one of the recipients of the Outstanding New Investigator Award really mean to you in your research?
Well, obviously I'm very happy to have this wonderful award. Makes a big difference because you feel that you've done something that has been perceived as good by the community. So that's I consider that as a great achievement. Makes life a bit difficult because you have to keep with this high level of achievements. But that's the good challenge.
Looking ahead, are there any additional contributions you hope to make within your research as well as the society?
Well, as far as research, so far all the work that has been done has been preclinical work. So it's been work done in cells, in animal models. Obviously, the goal would be to bring this body of work into the clinic and to start doing some clinical testing of the research we are doing, so development of new therapies, actually, really development of new therapy for children with inborn errors of metabolism. So this will hopefully will be something that I will be able to do in the next few years.
In what ways do you feel the American Society of Gene and Cell Therapy has really played a role in your scientific and career development?
It has been very important. Just to mention the fact, I did my interview before going to Baylor at the American Society of Gene Therapy. This was the name at that time. So my first exposure to gene therapy was actually during the meeting in Seattle, I think, in 2002. So that was my first exposure, and I really enjoyed that meeting, and this was how I was introduced to the field of gene therapy. So it's been critical for to get interested in the gene therapy and to be involved in the research in this area.
What advice would you or could you give a student or fellow who's interested in this field of gene therapy?
So the advice is it's a great field, and I think this is the right time to be in this field because there are so many achievements that have been done. So I think this is really a good time because the clinical translation is occurring right now. So I think it would be a great investment to be in this field at this point. And obviously finding a good mentor is crucial as well. Because you start when you have no much experience, you don't know much about the research in this field, and having a good mentors is very, very important.